Thanks for asking me to come and talk, and I'm going to take you on a little journey on something that probably a lot of you are struggling with, is the 7 care processes on the national audit and how to get them better. So a little bit about our hospital. So we are a busy DGH in the about 20 miles from London. We are, if you look at the national reports, we've got a high deprivation score, which was talked about earlier. We've got a very low high income score, so we are sitting in that group where people expect possible worse control. We've got about 220 patients at the moment. The team over the years has grown. We have 4 consultants, but actually those 4 consultants only kind of deliver 1 clinic a week each, and it's very difficult to get extra time in their job plans to do anything else. We've got 3.6 whole-time equivalents in nurses. You can see 1.2 dietetic support, 0.6 psychology, and admin support. But that admin support is a bit of a hotspot. So it's nursing support from a pure admin point of view, and then making appointments, etc. No real admin support around some of the data. It's all very basic with that, which I will come back to. So we've actually had Twinkle. I started in 2005. We already had Twinkle at that time. So we have used it for a long, long time and have been putting data in, but not done much with it. Over the years, clearly focus has changed. And I think particularly in the last few years, the focus on the actual outcomes for diabetes, improving the care, and now with the new NPDA reports, actually looking at your performance, quality of your data, the tariff, peer review, all those measures have made a real big change in what we do. So, where did our journey start? Don't worry about the reading it. It's our dreaded letter. Okay? It's our dreaded letter. And I think there's a couple of things in that letter. So when you get it, I've been away for about 2 years on sick leave. I came back, they told me, go back, take back the lead on, and within a couple of weeks we got the letter. So I was like, okay. So I actually didn't even know these letters existed, because I think it was the first year they came out, okay? I'd done our data for years on years. So we got the letter, and it basically said, we look at 2 things, your adjusted mean HbA1c and your healthcare completion rate, new metric, blimmin' typical. So they gave us, so the 125 patients is the ones that were over 12. So these were the ones that were in the completion rate. So then the letter went on, and they said, actually, your HbA1c is okay. So I was like, yes. And then I looked at the rest, and don't worry about not being able to read the numbers. They're going to come up in the next slides. But essentially, what made our unit a negative outlier, and outside the 3 standard deviations, was my urine result at 24%, okay, which dragged the whole thing down. But then the letter was more of a problem, because there was this bit at the bottom, which meant the letter went to my chief exec. It went to the CQC, and we were just in special measures at that time, because we'd had a very bad CQC review 2 years before. So there was lots and lots going on. So this was the last thing I needed. And then there was all these expectations. I needed to respond, I needed to do this, I needed to do that. And of course, suddenly I had the trust management on my back, which up till then really didn't give 2 hoots. They didn't know I existed down there. And now they suddenly wanted me, which was a bit of a problem. So all of you know this slide. You've all seen it. And so when I started in 2005, not really any of that existed. So over the years, pieces of the puzzle came in. And when this letter came out, the piece of the puzzle started to come together. The problem was that my management within my division really didn't have a clue about this piece of the puzzle. It was way too much detail. They just went doing diabetes clinic. That's it. Like you do a general pediatric clinic, constipation clinic, whatever. So it was really, really quite difficult to actually get the senior management on board with it. But of course they had to, because there was that letter. So how did their journey progress? Exactly at the time of the letter, the QI initiative came out. So I went, can we take part? We're rubbish. And they went, okay, come along. Because of it, I managed to persuade I kind of blackmailed my senior top team and just gave them a piece of paper, say, you need to sign me off, we need to go. And they went, okay then, and did. So we went and explored new roads. So we did some car karaoke. And on the road we were up to, we had to go as part of the national, we had to travel Birmingham, very early journeys they were. And then this is us at one of the sessions. And interestingly enough, the journeys turned out to be part of the bigger journey, because we car shared, we ended up chatting in the car, and that was extremely valuable. And what did we then do? So we went on the QI, and actually when we did the QI, you get asked to do a project whilst you're doing it. And our project at that time was talking about Diascend and how we could empower patients to use Diascend better, etc. So it wasn't about the 7 care processes. When we got back and we kind of finished the QI, we then went, and what are we going to do with the 7 care processes now? So then we kind of started implementing a lot of those things that we did. So we had learned about all the QI techniques, about pathway mapping, driver diagrams, you've heard about them earlier today, and basically play around with a lot of those little tools, and this is what it looked like. So actually what we did was we celebrated success, because of course there'd been a lot of negative pressure on the team about you've got poor outlier status, but actually we achieved an awful lot over the years, so actually just putting it on the board, celebrating success, makes you feel good. So then we did all kinds of things. So lots of pathway mapping and also a lot of parking of issues. So there's still a few bits to go, quite a bit parked. And this was just ongoing on little team away days that we managed to find a little room on another bit of the site where they didn't know we were there, so nobody could interfere and interrupt us, and we could get some time together. So we then started to focus on these 7 care processes, and we made the whole turnaround in about an 18-month time span. Now, if you're going to know the golden question, how did you do it? There isn't. So we did all very basic, simple stuff. We changed the clinic performer so that the boxes on the clinic performer were in the same order as our twinkle, so you could kind of match them up and not forget a box. We started to empower admin staff that if they saw that a patient hadn't had a blood result done, that they could send out a standard template letter to that patient to remind them they needed their blood results. We did some training and teaching for the secretaries and for clinic staff around what are these 7 care processes, how do they relate to diabetes care, what is diabetes, because clinic staff didn't really know much about it, and they suddenly felt much more engaged in the team, like, oh wow, I'm going to push this forward, I'm going to help achieve it. And the other thing we started to do, because this was right at the time that the platform for the audit upload changed, and you were able to start to do live data. So you could start to track your data and do more frequent uploads. And our team shifted from being absolute in denial about their data and not believing it was true. So, oh no, the urine isn't true because it's the way it was put onto the system, and actually they have done it not. And if you kind of started going into that, there was a lot of, for years and years, and I was as complicit as everybody else because I've been looking at this data for probably 10 years, our urine at 25% was 25% for 10 years. And we didn't do anything about it. And this was the driver to change it. And it was just by looking at it, seeing it go up, that we went, ooh, ooh. And then actually at MDT, the team started to say, have you got the next data upload yet? Because they wanted to see it. So these are examples of our team away day. This is us with a lot of food. And then we invited some of our adult colleagues as well to kind of do other bits of the work. So try and engage as many people as we can. We were lucky, we already had team away days twice a year for the 10 years, 15 years I've been there. But suddenly the team away day shifted focus, improved in quality, improved of the actual outcome of a team away day. So here we are. So Basildon is blue, okay? So these are the years, and I've been a bit naughty. Although that report is not out, I've taken them from the upload. Sorry, just because it looks good. So, first one, oh, didn't work. So we went up, and now we've bipped. Okay, I'll take that, because I saw the rest. So this is our urine. There's my 25%, and like I said, it was static for years and years and years and years. Boink, boink. Paying attention. Foot care. Retinal screening. Now, mean HbA1c. So certainly it should have been median. I automatically pulled the wrong set. So if you actually look at the start of this process, remember I said my HbA1c wasn't the problem. We've actually, for the last few years, have been in the green section on the funnel plot. So that was going okay, which is what kind of always reassured the team that we were doing all right, but we weren't. But nicely to see is that our HbA1c has continued to go down. So our median at the moment sits at 60, okay? That's the latest. So the 18, 19, so 64 is for mean, but median is 60, okay? So we're well below the national average. And this is if you look at it for each of the care processes in order. And you can see that they all have shot up. And if you then look at the total completion rate, so you know you get that thing, total completion rate for all your 7 care processes, which was the negative outlier state, this is what I am now on this latest upload. But of course I don't know what the rest of the country is yet, but that's a big difference. Yeah? So, what are my conclusions? Well, I haven't reinvented the wheel. But we implemented some of the things we learned as a team. And I can't highlight enough that for us, having the time together was key. The time to be together. We already worked well as a team. We already had common messages, but actually common focus was missing. Now we had common focus. Time together, regular little updates. We then realized we were starting to slip again in the last year. Why? We kind of stopped having regular frequent meetings. So we've put 10-minute meetings back once a week. Just 10 minutes to look at the board. What have we done? Who's got an update on this? Who's got an update on that? Who's got an update on that? So all of the team attending the QI has helped, even though some of my team members have changed now because people come and go in the job, but actually the new people then integrate in the common language. So we're no longer anxious about the data, and we now fully understand data is the key. We need data, we want data. The problem we now have, we want more data. So working as a cohesive team is important. Like I said, the live platform is really, really important. And I think small steps. We didn't do anything new. We didn't reinvent the wheel. We didn't come up with big changes. We didn't need new staffing. We didn't need new resources. This was just within what we already had. But if we can do it, you can do it. It's really, I'm that confident about it. But my little plea is that bottom one. Can we please have mandatory in peer review standards, or whatever other standards we have, a data person? Because I still struggle to make my trust understand that I haven't got time, skill, and none of my team have got time and skill to spend hours figuring out how to manipulate a table when there is some wizard somewhere who does click, click, and gets it. Okay? We're there to do patient care, and I need someone with the right skills to do the data bit. Data entry, but particularly also data analysis. Frequently, monthly, quarterly, whatever. And that's my biggest request and plea. So that's our team. Probably one or two has changed again, happens, but it is how we work and it's how it goes. And that's all I've got to tell you.